Welcome everyone. JP here with another cool interview with another kind of, thought leader, alternative thinker. Although it's mainstream for some of us. But first of all, Dr. Stewart Gillespie, thank you for joining us today.
Thank you. How are you?
I'm good, mate. I'm good. I'm very happy to have you on here because it's for a fitness brand like FitPro. It's a little bit off to the side, but everyone will understand how it all kind of relates back into our kind of physical movement well-being as we talk. But I guess really describe yourself as in what you do currently so that anyone listening who's not heard of you can get a
Mhm.
handle on what it is that you do now, and then then I'm going to leave that behind and go straight to your past.
Okay, no problem. Well, thanks for having me, John. It's a pleasure to be here, man. And hopefully there's no Google Translate for two palms being on the same podcast. You might need to
No, it's
translate what we
weird.
say. So we'll see. We'll see how it goes. But generally, I sort of specialize in the immune system. So, or how your immune system reacts to certain stresses, whether it be food related, whether it be exercise related, because stress does drive the immune system. Exercise is a stress that drives the immune system. And how your immune system reacts is depending on what's called your inflammatory type. And so there are certain things from your past that are underlying signs of inflammation that you have in the body that only come out under stress. So under stress, you might get cold sores. Under stress, you might get allergies. When you exercise, you might get delayed onset muscle soreness. When you exercise, you might start breaking down your tissues for no apparent reason. You might have antihistamines. You might have allergies when you work out. And so these are all signs that there's immune system in play. And so when you have signs in the immune system in play, when we talk about sort of things like weight gain and we talk about breaking body down and inflammation being the root cause of all disease, we now know that inflammation is actually run by your immune system. And so when you have an inflammatory problem, like an acute inflammatory problem, or even a chronic inflammatory problem, you have to start asking questions about your client's immune system or your own immune system as to why you might not be achieving certain goals or achieving certain bests, why your body keeps breaking down, why you can't lose weight, regardless of what diet and exercise regime you do, regardless of what supplements you take. And you might be stuck in some sort of immune problem. And that's what I pretty much teach about and run mentions about is how you deal or how you optimize your immune system. So rather than suppress the immune system, which is what most, so we say medical doctors do, is suppression. We actually try and optimize the immune system depending on what your immune type is. It's pretty much
Mm,
it, as it were.
cool, cool. All right. So I haven't done your education, but a lot of my students have done your education. So I've learned a heap vicariously through them
Yeah.
as a result. So I'll do my best to get into that with you a bit later. But how do you end up in that place? So I've introduced you as Dr. Stewart Gillespie. So
Mm.
you were a doctor and like in what kind of doctor were you, and then what happened? How did you end up in this place where you're now just you're teaching a lot of allied health practitioners, including the fitness industry.
Mm.
You're teaching them all this stuff based around immunity. So how do you end up there?
Yes, it's a long pathway, as you can imagine, John. It's a long, really long pathway. And sort of, but generally, I started as an osteopath in London, and was an osteopath and started at the British School of Osteopathy. I then moved to the US, and sort of decided to become an osteopath in the US, but I couldn't due to certain restrictions. And so I became a chiropractor in the US. So almost like did the course again, as it were. So 4 years an osteopath, 3 years as a chiropractor, redid the course, and then trained as become a doctor of chiropractic in the US. Um, and then after that, rather than working for a typical chiropractic office, I actually worked for a weight loss practice. I worked with a guy called Dr. Eric Berg, who's actually quite prominent on Instagram and stuff. And he talks about hormones and weight loss and ketogenic diets. And I worked with him about 4.5 years on weight loss patients, not even chiropractic.
Mm,
Um, and so, and because of my chiropractic degree, I learned about blood tests. I was the geek that was like learning about blood tests because I'd already done adjustments. I already learned about the body and musculoskeletal systems from my osteopathic background in London. So I started learning about X-rays and MRIs and blood work, which is what everyone was trying to avoid. I was actually sort of
mm,
involved in that. And sort of when I was doing sort of weight loss clients with Dr. Berg, I sort of realized that they weren't having hormone issues or weight loss issues. They were actually having underlying inflammatory issues causing their weight loss issues or
okay.
causing their inability to lose weight. And so then I started looking at their blood work, because I said, "Oh, bring your blood work and let's have a look at this blood work and sort of see if there's anything on the blood work that we can look at." And nobody else in the practice was doing that, and except for me. And then I could sort of see that they had actually underlying inflammatory problems on their blood work, underlying infections on their blood work, that I think was contributing to the very fact they had thyroid conditions or ovary conditions or hormonal conditions. Um, and that's when I started learning about. I did a weekend with a guy called Dr. Charles Poliquin. Have you heard of Dr. Charles or Charles Poliquin? He's some fitness expert that trained a lot of sort of Olympic style
Yeah.
athletes. And he's unfortunately, he died some years back, but he did a weekend course about hormones and weight loss as well. And I did a weekend course, and he told me about his functional medicine specialist that he was seeing for heart disease and cardiac problems, right? And I was saying, what's functional medicine? What's that all about? And so I just started looking at functional medicine after I did that weekend course. This is about 20 years ago. And I saw that functional medicine was basically adding sort of how you can test for certain things, how you use hormone tests, how you use urine tests, gut tests, stool samples, blood tests to figure out underlying causes of inflammation or underlying root causes of disease. And I thought, this sounds amazing. This sounds just like what I want to do. And I started doing some weekend courses in sort of functional medicine. And this is when they were only offered weekend courses back then. It was a very new thing. So I knew a little bit to be dangerous, but not enough to become an expert. And I was too
Yes.
busy in Dr. Bird's practice, chiropractic practice. I was seeing about 130 patients a week. I was too busy to learn anything new, right? As most professionals are, they're just too busy to learn anything new. And so I sort of put it aside. And it wasn't until I started sort of seeing immune problems in my clients, when they started to come in, that's when the wheels started turning. And I thought, oh, so there was a couple of cases that came in which sort of changed my life and changed the way I did things and changed my practice. And so I went more into the functional medicine world than the weight loss or chiropractic world. And that's when I sort of learned about functional medicine, did a mentorship. And then since then, because I saw a couple of clients with immune problems, I started specializing in the immune system. I could see that every client that came into my practice actually had an immune problem, weirdly enough.
Mm,
So things like allergies, things like fevers, things like autoimmune disease. And so how much is autoimmune disease on the rise now, right? Especially in the fitness industry world
mm,
and in the strength training world. And so it's almost like now you almost have to learn about the immune system to figure out what's going on with your autoimmune athlete or your autoimmune client or your autoimmune strength coaches or builders or
mm.
and so a lot of them do have immune issues, and but they don't know how to handle those things. And so I've sort of learned along with some doing some training how to teach other practitioners how to sort of optimize someone's immune systems. That's kind of the long 5 year, 6 year sort of way around that, and that's why I do immune system stuff now.
And now, like me, you're kind of based in Australia. I'm in Perth. You're on the opposite side of the country on the Sunshine Coast at the moment. And we're speaking to our home nation of the UK. Uh, so we're better known here than we are there. That's
Mm,
that. So I guess it would be important to start from the beginning when it comes to kind of your approach to things. What I must say I particularly love about it is it resonates fully with me because when I was looking at a movement body and someone comes to me with an issue, it's very rare. Like I'm talking 99% of the time. By the time they get to me, it's very rare that what they're presenting with as a symptom has anything to do with what the underlying issue is. It's always somewhere else in the body, and that's my job to find it, and that's what I do. And then
mm,
for you, what people present with, again, it's the same thing. You're like, okay, then we're kind of interested in the symptom because it tells us something, but it's a signal that something's wrong somewhere else.
mm.
And that's when you take the dive into, okay, then let's take, and I guess you start with a history, right? Going, okay, then where was the original kind of insult to their immune system in order to then build a kind of case as to what might be going on?
Yeah, that's so right. And just like you, John, I mean, I sort of ignore the symptoms, not ignore them, but just know that there's almost like a red herring, those symptoms, right? They sort of
Mm,
distract you from the underlying root cause of a problem, right? And so the symptom is just where the problem ended up. It's not where the
mm,
problem started. And so
yeah.
this is the same thing for musculoskeletal issues. I have joint pain, I have shoulder pain, I have calcium in my muscles. Why is that? Why is my tissues keep breaking down every time I work out? That's where the problem's presenting. It's not where it's coming from. And so when we look at where problems are coming from, you do a lot with nervous system and emotional work. There's a huge component of that on that because, as we know, nervous system interacts with our muscles and our fascia, and so we're going to get a lot of nervous system problems that are actually emanating or presenting in our fascia. But it's not a fascia problem. It's not a musculoskeletal problem. It's a
Mm,
nervous system problem, right? And and when we talk about nervous system problems, it's usually because of undealt with emotions from our past, right? That is sort of
mm,
presenting today as if we were still 5 years old, right? And so that unhealed trauma, as so to speak, the immune system acts the same way. And so the immune system is like the nervous system; it never forgets. It always has its long-term memory issues, right? And so immune system presenting today like autoimmune disease or allergies or delayed onset muscle soreness or histamine issues are usually because of an unresolved infection from our past. And
mm,
so this is why you have to go into someone's history, not today, but go in someone's past and figure out what did you have when you were 2 years old, 3 years old, 4 years old that you didn't deal with that is now presenting today as an autoimmune disease or presenting today as musculoskeletal pain. And what you'll find is when you start asking the questions about what you do, like nervous system, when I start asking questions about the immune system, like do you get allergies? Do you get histamine reactions? Do you get runny nose after workouts? Do you have autoimmune disease? So when you ask those sort of questions, you sort of figure out that there's something underneath their fitness goals. There's something underneath the reason why they keep breaking their body down. And it's usually an immune component of that because the immune system runs inflammation. And so that's basically asking questions. And you can get certain tests done. You can sort of get certain functional medicine tests done to sort of look at the immune system, but it's usually an unresolved infectious immune trauma from the past that they haven't dealt with. Um, for example, someone might have tonsils removed when they're 5 years old, and tonsils are an underlying reason for having a viral load. And so a viral load will present your tonsils and take tons and tons of antibiotics to get rid of those tonsils, but it doesn't help the problem, and therefore they have to take the tonsils out. But taking the tonsils out does not take away the underlying infection. It just removes the warning sign to that underlying infection.
mm.
That infection is now not presenting in your tonsils anymore, it's presenting somewhere else in the body. And viruses present in your joints, viruses present in your brain, viruses present in your nerves, viruses present in muscle tissue, fascia, all these sort of places where viruses can present. And so the same thing when someone has their appendix removed, it's usually a sign of underlying gut infection or gut problem. And then 20 years later, people can't understand why they keep getting bloating issues, why they keep getting gas, or they keep getting digestive problems, or even Crohn's disease or ulcerative colitis, autoimmune diseases of the gut. And it's usually as a result of having your appendix removed when you were 12 years old. And so these are sort of things that we sort of resolve with our clients as we go back, find out what did you not resolve in the past, resolve those issues. And usually whatever's after that is a symptom of that past problem that they haven't dealt with. And so that's pretty much what we do in a nutshell.
It feels like it's like we all push on, like we're all kind of in that industry of pushing on, moving forward. And I feel like, we're all on a road going to a place that we're always meant to go across life. We don't know what that place is, but there we are. And at some point, something forces us to take an entirely wrong turn. So, but we keep pushing forward because we don't know that that wrong turn has been taken. We're just pushing forward in life, and then we end up in this place, and we'll think, "Well, this is a bit rubbish because it's not what I had planned for my life." And as you say, if you then get that place and you remove the place where you are, that doesn't mean that the wrong turn hasn't happened, and you're still in all the way down that road. So you've got to kind of get a new map, as it were, and that's by kind of backtracking and going, okay, where did we make the wrong turn in the first place, unknowing to ourselves,
Yeah.
right? So then the
100%. Yeah. Uh, yeah. Sorry to stop there, John. But I mean,
right.
you're quite right there. I mean, and people are always, especially in the fitness industry or in the strength coach industry, we're so driven. The clients in that industry are so driven. Usually, nervous system stress drives an immune system problem as well, right? And so this is where stress is very important when it comes to that, and exercise and over exercising or that perfectionist type sort of mentality will drive some of these immune issues as well. But it's almost like, yes, it's people are always looking for something outside of their body to make them feel better, right? Or something outside, some sort of supplement, something that helps you actually make me feel better. But it's usually something unresolved from your past that's already there that you have to sort of delve into and fix, right? And so it's not really reaching for something outside, but figuring out where did you take the wrong turn? Where did your body take the wrong turn? And as you say, you have so many symptoms that your body's knocking on your door saying, hey, you've got an issue, allergies, or you have histamine issues, or you have rashes on your skin, or you have sensitivities to grass, sensitivity to pollen. You can't do red wine because they give you issues. You can't do gluten, you're lactose intolerant. All these sort of signals that there's something going on there. And if you don't deal with that problem, it's going to present as a much more serious problem down the road. And then you're
Mm.
thinking, well, where did that come from? Why did I end up here? It's because you ignore the symptoms from your past that I've actually sort of telling you that there's something going on.
And we can, and there's all sorts of ways that in the world that we live in today, there's all sorts of ways where we can just have those symptoms disguised or downplayed, or let's just deaden the issue. If we can drug it or in some way smother it so that we're not dealing with that symptom, then we're good. And that's the thing, is that if you eliminate the symptom, that doesn't eliminate the underlying thing.
Yeah. Yeah. You can't remove things from the body and expect things to go away. It doesn't work that way. And as you said, you can't suppress symptoms and then all of a sudden wonder why it's presenting somewhere else down the road, right? So you might remove
Mm,
tonsils and you might get rid of your tonsil pain, but then it will present down the road as a shoulder pain or brain inflammation or Alzheimer's or memory issues, those sort of things, right? And so it eventually will come back to bite you if you don't address it. And so those are sort of things you're sort of looking for in someone's past, why that's happening. But yeah, you're always getting clues, and most people will sort of think that allergies is just an allergy problem, but it's not. It's actually an immune problem.
mm,
Autoimmunity is an immune problem. Autoimmunity is a symptom of an underlying immune problem. Allergies is a symptom of underlying immune problem. And so when you have those issues, don't ignore them. Don't take anti-allergy medication or don't take immune suppressors to suppress those signals, right? It's giving you information that there's something underneath going on. And so this is when we take anti-fever medication as a kid, we're blocking our fevers. When we take anti-allergy medicine as a kid, we're blocking our allergies. When we take antihistamines, we're blocking our histamine responses. But by doing that, we're suppressing our immune system. And so when you suppress your immune system, you're just squeezing it into a different direction somewhere else. It's going to come out in the body somewhere, either as a skin problem like acne or psoriasis, or come out as a joint problem, or come out as a muscular pain or fascia pain. And so this is why you can't suppress. And if you do try and mask those symptoms, it's going to become a bigger autoimmune issue down the road rather than just a simple allergy problem.
mm.
Yeah.
Okay, so we've got that happening. So then what you would call like an insult to the immune system happens at
Mm.
some point, and then that can exacerbate over time. But we've got this set of immune responses that in an ideal world we want in balance. So the thing, I had someone do a protocol for me so that I was able to kind of understand it better, and that was 5 years ago now.
Mm.
And there's Th1, which is kind of that catabolic kind of pathway, and then there's Th2, which is the growth pathway, and there's Th17. There's these high-tech numbers that I don't remember them all, right? But that doesn't mean that you're naturally one or the other. We become dominant in one of them. And so for me, it was the catabolic one. So I was Th1 dominant. So my nutrition, behaviors, environments, the way I handle stress, all of that kind of thing can be looked at, supplementation as well, so that I'm driven towards Th2, not because I need to be Th2, but
Mm.
because we need to balance between Th1 and Th2. That's my most simple kind of explanation based upon my own experience of it, right?
Yeah.
So we're looking for balance. We're not looking for we need them all. Because I guess if you've got a tumor, you want to drive towards Th1 because you want to help reduce that. You want it to be catabolic, but you don't want to be in a growth dominant pathway like that. But there's a whole lot more to it than that. And also, of course, the things that express, you could have a tumor, but you could also, or you could have, I don't know, rheumatoid arthritis, and
Mm.
they have the same root.
Mm.
That's the
Correct.
other thing that can happen as well. So make sense of that garbled thing that I just threw at you.
Yes. So inflammation, right? And so picking it with right. So inflammation is the root cause of all disease. But all inflammation, we need healthy inflammation. Inflammation is the way we break down infections. Inflammation is the way that we break down tissues, like in teething. When babies teeth, they're having inflammatory breaking down their gums, so they need inflammation to break down the gum.
Mm.
And so we need inflammation in certain pathways. If we can't heal unless we have inflammation, and so the healing part of any problem is that you have inflammation, then you need to heal from that inflammation. So you don't get healing without inflammation. And
Mm.
so that's where inflammation is to our benefit. It's when we get those acute inflammatory pathways is what we need, right? And so it's when we get stuck in those acute inflammatory pathways that's when we start to get issues. And so chronic inflammation is the forefront of disease. And so we have to sort of look at what runs chronic inflammation. And it's the difference between our innate immune system and our acquired immune system, just to try and make it as easy as possible as we can right now in the short time we have. But acute inflammation runs your growth and repair of things, and your acquired immune system, that's the system that sort of runs allergies, runs autoimmune disease, runs fevers, runs histamine reactions. And so all these different Th1, Th2, Th17, Th9 responses, there's now 7 immune types. When we first met 5-6 years ago with Dr. Perry, right, there was only 2 immune types, 3 immune types back then, right? But now there's like 7, 8, even growing immune types at the moment. And so when we talk about the immune types, is that there's inflammation. Everyone has inflammation, but everyone has different inflammatory types based on your immune type. And so you might get autoimmune reactions to an infection. You might get cancer reactions to infection, which is like a growth Th2, Th9 problem. You might get itchy skin. You might get histamine reactions to a problem, which is Th9. You might get skin problems, which is Th22. So there's all these different types of things going on. Th1 helps you get rid of viruses, all this sort of thing. But when you sort of say that you're catabolic, it means that you have either a catabolic type of immune system, Th1, Th17, when you're breaking your tissues down. And so this is when those clients come in, you're in the gym, you're trying to work out, you're driving stress, you're driving your bodies, you're creating inflammation. But as a result of inflammation, you're driving catabolic processes in the body. So these clients will break their tissues down all the time. They'll keep getting injuries, recurrent injuries, and they can't heal from those injuries. And then you have the opposite type where the clients that come in, they drive their anabolic pathways, they drive their Th2, Th9, cancerous growth type issues, or
Mm.
allergies when you swell up, histamine issues when you swell up, you get swollen, puffy eyes, you get swollen, puffy tissues. That's more of a Th2, Th9 anabolic pathway, and you get clients who have problems because of that. And so but it's not that we don't need those things. We do need those things, but as you say, it's a balance of those things. And so it's not the strongest immune system that survives. It's not the strongest immune system that wins. It's the most adaptable immune system that wins. And so you want to be able to move around and go anabolic if you need to, go catabolic if you need to. And you need a balance of both catabolic and anabolic pathways to break things down and then build things back up again. That's what we do in the gym. Right? We want to break our muscle tissue down and then build it back up again. But there's some clients, they break their tissues down and they can't build back up again.
Mm.
So your catabolic type clients. There's those clients that are anabolic and they have growths, they have cysts, they have tumors, they have fibroids, all this type of stuff. They have growth issues and they can't break things down. So when you described how can we break down tumors, we have to drive our catabolic process to break down tumors. You're
Mm.
quite right. And that's what the immune system does. If you have an anabolic process going on that's out of control, like a Th2 cancer, then you need your Th1 immune system to break those cancers down. And so it's always the balance between the two. And we now know that there's ways you can drive different parts of the immune system now, depending on what sort of lifestyle you use or what sort of supplements you use. What are the things that might be blocking you from that immune type? What are the things that are sort of like antihistamines, anti-fevers? What are blocking your different parts of the immune system? And why do you need to sort of unblock those things? And why do you need to drive them? It sounds really complicated, but we try and make it as simple as possible so that people understand this in that we're trying to optimize your immune system rather than suppress it. For years now, we've suppressed the immune system. When you suppress the immune system, the underlying root problem always comes to the surface. And so you can't suppress anymore. You just have to optimize depending on what is driving your immune system. Is it a toxin? Is it an infection? Is it stress? Is it emotional? And there's a big thing these days about your neuroimmune system, your nervous immune components to problems and autoimmune disease and muscle pain and MSK problems. And so how the nervous system and immune system react is extremely important now. And so you're trying to optimize those systems rather than suppress those things. You can't suppress your emotions. You can't suppress the nervous system. You can't do that with the immune system either. And so how do you optimize these things is what we sort of basically teach people all over the world. So.
And I guess with the immune system and the nervous system,
Mm.
I mean, both of them are there
Mm.
to keep us safe. So they would have a lot to do with each other.
Correct. And so your immune system, most people think that it's like a nervous system. It's something that's out of control. I have anger issues because I can't control my nervous system, right? It's not that. It's not that you can't control your nervous system. That anger mechanism is trying to protect you from something. It's trying to protect you from a past hurt, right?
Mm.
And the same thing with the immune system is that you have an immune drive, like a Th1 catabolic immune drive. You're breaking your body down. You think your immune system's out of control. Let's suppress that. It's not that. The reason why you have a catabolic immune system is because that immune system is trying to break down a toxin or break down an infection or break down a blood sugar. That toxin, that infection might be in your tissues. It might be in your gut lining. It might be in your joints. And so your immune system is actually breaking down something within you, not actually breaking your body down, but breaking something within your body that it needs to protect, needs to save you from, needs to protect you from. And that's where people are making mistakes about their immune system, thinking it's like, I've just got to suppress it and my problems will go away. It doesn't happen that way anymore. We're not thinking about the immune system like that anymore. And first of all, figure out what is your immune type, and then figure out what is driving your immune type. Is it a parasite? Is it heavy metals? Is it stress? Is it over exercising? Is it under exercising? Is it hormones? Is it infection? Is it virus? Is it mold, which is quite prevalent here in Australia, of course, right? And so we're getting a lot of mold issues here. But yeah, that's what you have to sort of think about with the
Mm.
immune system.
I mean, just to give an example, again, this is really for the
Mm.
listeners, like just to give an example, I was Th1 catabolic, and my favorite thing to do at the time was distance running on soft sand. That was my particular thing. It's really hard to do, to be barefoot on soft sand and run for a long way. That's really hard to do. So that was my thing, because we all kind of want to challenge ourselves in different ways. So that was my thing. And I think I was running like 20 Ks at a time on soft sand, which, like, it's hours. And then I got this information where it's like, okay, then so you teach one. So this whole long slow distance thing, this endurance thing, is catabolic as well. Like, wow, I'm doing a massive catabolic act on top of a Th1 activated immune system.
Right.
It's
Yeah.
no wonder I get every cold that happens to be passing, Western Australia. So, but what I kind of wanted to kind of calm people's nervous systems down, really, is that it sounds like sometimes you're gonna have to tell people to stop all the things they love and do lots of things that they don't love. But it was just a simple tweak. It's like, no, if you do high intensity intervals, you can still do those on soft sand. You can still do sprints and then walk, and sprints and
Right.
walk. You can still enjoy the thing it's just the way that you do it that you have to change. And it's very similar, I think, with the nutrition side of things as
Mm.
well. It's a
Mm.
it's an adaptation. It's not a complete overhaul. Like, it's a very doable thing. And it doesn't need a lot of motivation once you feel the change. Like, you
Mm.
feel the change quite soon, I think. Like, is that what most people's experience is, that they feel change relatively within days? I'm talking here.
Yes, and this is very important. Is that you're quite right about that. And so you should feel changes in your immune system within days. Why? Because your immune system acts within days. And so when you have a fever, how long do you have a fever for? You have a fever for like 24, 72 hours before you get rid of the infection. That
Mm,
is how your immune system should work. It comes in, fights the infection, then comes back to homeostasis. It comes back to normal. Some people don't come back to normal. Some people stay stuck in an immune response. And so those are the clients that tend to get autoimmune disease. They tend to break their body down, or they keep breaking their body down. They can't get out of that problem. Even though the infection is gone, they stay stuck there. Um, and so when you're trying to drive your immune system pathway, you have to sort of one, give out as few supplements as possible. And what we're going to find out, learn about is that some supplements drive TH1, some supplements drive TH2, some supplements drive TH17. And so you're almost like, some people are taking too many supplements. Some people are taking the
mm,
wrong supplements for their immune type because they're driving the immune system the wrong way, or they're making their immune system more powerful or more catabolic. Just like running will make your immune system more, or cardio running for an hour will make your immune system more catabolic than anabolic. And so you have to sort of change your lifestyles and change your diet and change your supplement plan depending on what your immune type is. But if the immune system works in 3 to 7 days, also your solution should also be that way. And so you should see changes in when you change someone's supplement plan, and when you're trying to optimize the immune system, it shouldn't take that long. And so I tell practitioners and tell clients to sort of do 14-day immune protocols, 14-day immune plans, to try and reset the immune system, optimize it, drive it the right direction, and take less things rather than more things. I usually end up taking away supplements rather than adding supplements, actually a lot of the time
Mm,
with clients, because they're taking too many things. They're driving their immune system in different directions. The immune system's like, what the hell is going on? And so you just need to focus sometimes when you're doing immune system drives. But it's very important to actually sort of get changes within days. You remember Perry, right? Dr. Perry.
mm.
We actually met through Dr. Perry's Dr. Perry and I did a workshop
We
in
did, yeah.
Perth, right? And that was what, 5, 6 years ago, right before COVID, right? But right before lockdown. And so that's when we met in person, right? And sort of, if you remember Perry's testimonials, he saw changes within 3 days, 4 days
Yeah.
after having a chronic problem for a long, long time. And that was, as you say, just making very simple. I took him up all the things that he was doing and just gave him 3 or 4 things to drive his immune system in the right direction. And you see those changes within days, because that's how your immune system works. That's how it's supposed to work. So anybody doing 3 month, 6 month, 9 month immune protocols or immune driving protocols are missing the boat. You can actually overdrive the immune system in the right direction. So
Mm,
you can drive the immune system right in the right direction, but if you overdrive it, you're just going to get problems driving in that direction, if that makes sense. And so
mm,
you always want to sort of drive the immune system in one direction quite quickly, and then bring it back to homeostasis, bring it back to normal. And what we see these days with a lot of clients, particularly in the fitness world, particularly in this high stress, like powering world, is that they drive their immune system too much in one direction. And this is where changing their lifestyles, changing their exercise regimes, getting more vagal tone days, getting more parasympathetic days rather than sympathetic days actually helps them in terms of recovery, in terms of wound healing, and also in terms of like personal best and optimizing their
yeah.
performances. That they need to rest actually more times than they need to work out for some immune types, particularly those clients who have autoimmunity, particularly for those athletes that have autoimmunity, is because be careful driving your body in one direction only. It will suffer. And it's just as simple as changing a few things, changing your recovery days, changing the way you exercise. That is really important with that.
And it's very difficult to get those kind of people, let's just call them type A people, to accept that. It's almost like the conversation you have to have is like, if you want the best, right? You're striving for perfection, you want the best.
Mm,
This is part of your protocol, this is part of your training plan, is to do this. It's like they have to actively not do things in order to be better at doing things.
for sure. For sure, and you know that in your work as well, John. And try and tell an athlete to stop running.
Mm,
You may as well. You won't hear the phone call ringing again. They won't be picking up your phone.
yeah.
And so you're just trying to change their lifestyle, give them like a period, like 2 weeks to 4 weeks, where they sort of calm their immune system down, calm their nervous system down, right? And therefore they can then go back to their normal routine once you've got rid of the underlying problem that's causing their maladaptive nervous system response or their maladaptive immune system response. And they do go hand in hand, as you might realize, is that body inflammation will cause brain inflammation, which is nervous system inflammation, right? And nervous inflammation will create body inflammation at some point. And so you have to do things hand in hand sometimes. And so this is where doing a combined approach of nervous system and immune system approach is really, it's the new thing. I mean, if you can sort of do neuroimmune protocols and just work with those sort of things, you're going to fix a lot of issues in your clients and a lot of
Mm.
issues in your life, actually.
Which then gives them better results when they come to, if they're highly motivated in the gym or in a sport, some form of physical physical endeavor, then it will support all the things that you want for your physical body.
Yeah, which will then support all the things in your brain. And so, so we do know that physical inflammation will create brain inflammation, right? And so if you can calm down physical inflammation, you can calm down your brain on fire, calm down anxiety, depression, memory issues. And so how much of performance these days is mental? I mean, you probably know this better than I do, right? But your mental approach to your sports performance is huge now, right? And there's so many much information about this now, about how you change your how you relax, how you sort of change your thoughts, and how you change your thoughts in order to drive performance. You also change your thoughts to drive not being in pain. You can also drive your thoughts to not have autoimmune disease. And your immune disease that you're having in your body, your autoimmunity, can actually stop you from having, if you calm that down, you can actually stop, your brain can fire. You can almost get rid of brain fog by calming down, say, candida in the gut. You can calm down brain fog. And so it's a two-way street. And so gone are the days where I just work on the immune system. I used to just work on the immune system, but now it's nervous system and immune system. We have to work on both. And so I think you're finding that as well when you did your immune protocols, is that all of a sudden you started to think better, you started to perform mentally better, and vice versa. So
I think the thing that I felt, it was some kind of like, I felt inner power, like I felt innerly powerful. Like that's the way I would describe it. There was something about it. But I mean, I took it too far. I had a fourth child as a result of going, do you know what? It'll be fine.
got it.
So that's how up I was feeling, is I felt strong enough to deeply complicate my life. So let me ask you about, there's a couple of things that kind of keep coming to the front of my mind, and that's like when you were saying about things that people putting into their body, they could be doing really healthy things, but actually it's the opposite of what their immune system like oh, kombucha is great for everyone, right? But actually if you're already I'm assuming Th2 dominant, then actually that's way too much, for example. And then what came floated into the front of my mind is like fasting. And I'm going, okay, then so when we talk about fasting, that would be great for driving you to almost towards Th1, because it would be about breaking down, going into autophagy, breaking down rubbish tissue, rebuilding, repairing. But is fasting actually good either way for like either side of that coin? Like I don't want to make this whole thing about fasting, but I
No,
got confused with my little thought pattern as you were talking there. I'm like, oh, is it? So what is it? Like, how is that useful? How is that helpful? Because we know it's good.
yeah, it is good, and it's certainly good for certain immune types. Just like you say, as you say, kombucha tea and fermented foods are good for depending on your immune type. Ketogenic diets are good depending on your immune type, and so not
Mm,
everybody can do a ketogenic diet. Not everybody can do a carnivore diet. Not everybody can do a pea protein vegetarian diet. Not everybody can do a low histamine diet or a fermented food diet. But to sort of think that one thing actually helps everyone, it doesn't. It doesn't. From my years of experience of working 5 years in a weight loss practice and 15 years doing this autoimmune stuff, there's no one diet out there. And so what it is that there's certain foods that drive your immune type. Say fermented foods you mentioned, right? So
mm,
fermented foods is drives histamine. Histamine is a Th9 response. There's now a Th9 response. And so and Th9 is sort of when you get histamine outbreaks, and this is where you get runny noses, you get delayed onset muscle soreness, you get neuritis, you get inflammation of your nerve roots, you get neuropathic sort of issues going on there as well. And so there's 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 that, and so those people have to avoid histamine type foods, things like collagen bone broth, things like aged foods, aged garlic that have high histamine contents, avocados have high
mm.
histamine contents, and so those sort of things you have to avoid if you're a Th9 dominant type of person, right? And then there's your sort of people who have to avoid milk or lactose intolerance, and therefore they think milk is the problem. It's not actually. It's actually milk is driving candida, which is driving a Th2 allergy problem. And so this is where even those people have to avoid milk for a little bit while they sort of reset their immune system. But in terms of fasting, so fasting is really good. Remember that sort of old sort of proverb about you starve a fever and feed a cold, right?
Yeah.
You heard of that, right? And so Th1 is a fever response, and you talked about fevers, right? And you talk about your Th1 response. And so when you're stuck in Th1, you're always sweating at night. You always have a fever. You always feel as though you're fighting something. You're always tired all the time, and it's because you're just basically fighting an infection all the time. And it's usually a virus, because fevers are your Th1 system kills off viruses, and you get fevers because of that. And so when you have those fevers, you usually don't want to eat. or you're usually not very hungry at all. And that's the old analogy, is that fasting is very good for a Th1 immune type, Th17 immune type, or a catabolic immune type, is that you're actually starving the body of, or you're starving the virus of any food. And therefore, starving is very good for a Th1, Th17 body type. And that's where it comes in. But then again, starving isn't very good if you want to build muscle tissue. And so you do starving for a little bit until maybe, and I think fasting these days, the most you should do it for is like 3 days. I think the optimum thing for fasting is between 24 and 72 hours now. If you do more than 72 hours, you kind of reset your immune system completely. You get rid of cancer. If you go and do forest bathing for 3 days in the forest, and you sort of didn't do any fasting at all, they're now shown in Japan that will get rid of breast tumors, that will get rid of cancer if you do 3 days of fasting in the forest. And so there's lots of research on that. And so this is where fasting is really good for resetting your immune system, but it's not something you should do for a long period of time. And so
Mm.
it's like when you do anything too much of a good thing, is you shouldn't be doing too much of it, because you can actually sort of get problems doing too much of a good thing as well. And so this is where there's research both on which way it drives your immune system, but fasting is good. And the reason why it is good, because it drives something called autophagy. And autophagy is how your body clears out infections, how your body clears out debris, how your body repairs tissues, how you detox your body. And so everyone trying to do a detox protocol, or trying to do juicing, or trying to do detox protocols that do amino acids and protein shakes and juice shakes and stuff like that, you can actually do fasting, do it cheaply. You can actually get your body to detox by itself, or self-detox by getting into autophagy. And this is how we teach how to get into autophagy, and that's usually driving what's called your innate immune system. And so we talk about that extensively. But your innate immune system is basically walking in the forest, grounding, forest bathing, lunar bathing, sunbathing drives your innate immune system. And that's what you
Mm.
can get into autophagy. And autophagy is where you're fasting for like 14 hours a day, and then you clean the body of cancer, you clean the bodies of infections, you clean the body of toxins, heavy metals, that kind of stuff. And that's ideally what you'd like to do, rather than doing juice cleanses all the time. It's a
It
butterfly.
is pretty amazing, some of the stories that are out there, and
Yeah.
it seems to be consistently reproduced, which kind of, gives you a little bit more faith in it, right? It's like that's the thing. But the
Yeah.
stuff where it clears cancer amazes me. Like the idea that, yeah, and obviously they're more extended fasts, but man, that's some powerful stuff right there. So, all
Mm,
right, we have a lot of people from the exercise industry that will be listening to this.
mm,
So if you had a kind of a message for them, other than do your education, of course, are there some nuggets that you'd go, be aware of this with your clients, or be aware of this for yourselves, in fact, because most of them are
mm,
beyond the stress limit, let's face it. Like our industry is one of those strange ones where we help everyone get healthier, but a lot of people that are trying to help people get
mm.
healthier drive themselves into the ground along the way. So what do you think is more relevant for those people? What are the things over the years when you've been working with fitness professionals, that really comes up as really powerful for them to kind of think or know or do?
It's a great question, John. And it's not easy. I think that sort of question has sort of evolved over the years as well. I mean, it's been different
Mm,
things. I used to say in the olden days, just take collagen, you'll be fine. But even taking collagen might be problematic for some people these days. But but I think just to sort of be more self-aware, and just sort of say that your body is actually giving you clues all the time in your clients as well. And it's funny because in the first 2 weeks of the mentorship we do, is that we tell our practitioners, like, you will see immune problems in every single one of your clients if you just look for it and you just ask the questions. And so allergies is an immune problem. Histamine issues are an immune problem. Autoimmunity is an immune problem. Fevers, virus, cold sores under stress, acne, psoriasis, all these autoimmune, Crohn's disease, all that, there are immune issues. And so a lot of us are having problems with that. We may not see that in our 20s. These young athletes out there might not see that in their 20s. But certainly as you get in your 30s and your 40s, you start to get these immune issues, and you sort of don't realize you're having immune issues. And so just think that allergies, autoimmunity, fevers, cold sores, infections, parasites, gut problems, diarrhea, constipation. They're all signs that they're immune issues. And so just take a little sort of just look at yourselves, look at your clients and sort of ask them if they get allergies, ask them if they get histamine issues. Are they taking certain immune blockers like acid reflux medication, antihistamines, anti-fever medications that are blocking their immune system and because they're having immune issues? And realize that these immune issues, the longer you block them for, they will become a bigger problem later down the road. And so if you're trying to optimize your performance and trying to optimize your body, you have to look at your immune system. We now know that muscles have immune cells. We now know that fascia has immune cells. We now know your joints have immune cells. Your skin has immune cells. And so when we have an immune problem, it will show up in your muscles and your joints and your fascia, and you don't realize it. And so the first thing to do is just to stop for a second. Don't look for something outside of your body. Just stop and just take a mental note. What is going on with you? When you work out, do you get a runny nose? When you work out, do you get joint pain? When you work out, do you get delayed onset muscle soreness? Do you tear your muscles down every time you work out? Look for those things in yourself and your client as a reason why you might be having some sort of immune issues from your past that are rearing their ugly heads. It's probably the best advice I can give out.
Yeah. All right. The other thing that I thought would be an interesting thing for people to know
Mm.
would be, I mean, I've been lucky enough to sit in on people taking histories. So
Mm.
I've referred people to practitioners that have done your training, and then I said, would you mind if I just listen in to them taking the history, because it's just so interesting.
Mm.
And those initial kind of insults that I know you call to the immune system, they can be many and varied. And the thing that really struck home for me was half seemed to be non-physical, as in, oh, that this was, oh, there was one distressing one that I listened to, which was, was abuse as a child, for example. And that was the trigger and in an immune response and the issue along the way. But it can be trauma, as much as it can be, you had, say, what would be a kind of a glandular fever, would be
Mm.
like something like that. I think I had glandular fever when I was about 12 or something like that, right? So it's that initial hit, but that it can be anything. And people, I feel like, it's getting better, but more of us need to open our minds to the fact that when you are experiencing something in your physical body, that doesn't mean that it had to have a physical trigger in the first place. I mean, I don't know, you've seen thousands. So
Oh,
what would
right.
your experience be?
Yeah, so right. And so you're talking about childhood trauma. And so what we're seeing with autoimmune disease in your 30s and 40s, it just doesn't happen in your 30s and 40s. And so you don't all of a sudden wake up one day, oh, I've got rheumatoid arthritis. Where did that come from?
Yeah.
It's a progression. And so when you deal with autoimmune clients in the 30s and 40s, you can see that their history is pretty much all the same, right? They've either had gut issues or they've had constipation, diarrhea since they were a kid. They've had allergies since they were a kid. They've had eczema when they were a kid. They've had their tonsils removed, had their appendix removed. But the biggest driver of autoimmunity these days is trauma and nervous system distress. And we see that with childhood trauma increases your likelihood of autoimmune disease in your 30s by 7 times, 8 times as much.
Yeah.
And so, and not that, and so this is where can manifest in the body, as you know, right? But distinctly as autoimmune disease, and we saw this during COVID. I mean, so it wasn't only the vax or the virus that we were dealing with; it was being locked down. The very fact you couldn't see your loved ones who were in distress, and so that emotional trauma, that emotional stuff, that being locked away from each other, being separated, has been the biggest driver of autoimmune disease. This is why autoimmunity in the last 5 years has exponentially gone through the roof. And this is why we're seeing so many immune inflammatory problems now that only show up when you exercise, that only show up when you work out. You're like, why have I get joint pain now when I work out? Or why do I
Mm.
keep tearing down my muscle tissue when I work out? And you'll see there's a lot of emotional trauma that is driving that. And we see that with childhood trauma, and we see that with lockdown. And when it's funny because when they do experiments on mice and rats, right? How they figure out how the nervous system drives the immune system to stress is that they separate mothers and kids. They separate mothers and babies when they work on rats and they work on animals, and that is how they drive trauma in these animals. And this is how they look for immune responses because of that.
Mm.
And it's now well researched now that emotional problems, trauma will drive the immune system, just like exercise drives the immune system now. And so many things drive the immune system. You don't have to have an infection anymore. And so a lot of clients will sort of say, I never get sick, I never get problems, I never have any sort of virus issues, right? Or never have Epstein-Barr virus. But for some reason, I keep breaking my body down. For some reason, I can't get optimal.
Yeah.
There's something blocking my progress. And this is when you maybe start looking at nervous system distress. And there are certain clues, as you know, of nervous system distress as well, right? And so you look for those clues as well as immune system clues. And this is how you sort of become the detective and sort of work these things out. And quite often it's always from your past. So you might test something today and be normal, but it's from your past that you haven't dealt with. And so this is where the best people that deal with this stuff always go back into your history and see what haven't you dealt with from your past.
And that's like you say, that's awareness.
Mm,
It's also an awareness on behalf of our clients as well. So, just be aware that stuff's happened, and just to have an awareness that there might be something from a long time ago
mm,
that yeah, that was the original trigger that's doing that may be nothing to do with all the amazing work that you're doing along the way. The other thing that I would sort of say about that would be when I do mindset work with people, if there's something that's happening now and it's from their past, it's not from their past because it's still in their head now. So it's actually from the now. Like that's the thing. We can only ever be in the now. So whether we're thinking about the future or we're thinking about the past, or whether subconsciously something is from our past or not, it actually is in the present.
yeah.
So it's not, we're not raking up history and going, oh God, you're always talking about, like, no, we're not. We are talking about your childhood, but we're not, because it's happening right now. We're talking about the present you,
Mm,
and that's what we're dealing with. And we're also going to deal in that present. So for me, that's kind of a powerful thing for people to really understand that, yeah, it can be from various stages of your history, but it's not. It's actually you now. Like this thing that was when you were 5 is not. It's when you're 35, or it's when you're, 55 in my case. It's now. It's happening now to you. So we're dealing with the present you, despite the fact that it dates back to that time.
mhm.
That to me is kind of an important message for people to understand that, yeah, we're not trying to fix stuff in their past. What we're trying to do is help them with something that's happening in the present.
Yes, that's still stuck from the past. Yes,
Yeah.
and sometimes, as you say, sometimes it could be an infection from you when you're 5 years old, but your immune system, even though you got rid of that infection, your immune system still thinks it has it. And so it's almost like a hyperimmune response from 20 years ago, right? And you're still stuck
Mm.
there. And this is where sometimes you just need, as you say, just need that flip and calm that immune system down. Then all of a sudden things go back to normal. And it's just that you haven't returned to your innate immune system. You haven't returned to your calm state, right? And so and sometimes it just takes a tweak of certain things to calm your immune system down. And most people, as you say, are doing the wrong things or taking too much to calm their immune system down. And you just have to take a few things just to drive it in the right direction, just like you do with nervous system stuff, right? And so, but yeah, it's from practitioners who've done the course, right? And so you will see that most practitioners only give out 4 or 5 things to their clients, and most of the time clients are on 20 25 different supplements when they see their clients. And so they're actually taking supplements away from clients because it's actually driving their immune system too much or in the wrong direction.
Mm.
And so this is where less is more, and a more focused approach is much better than taking too much or taking too many things.
So there's too much. There is such a thing as too much of a good thing, which I've been saying many, many times at the most basic level.
Yeah.
Most people, broccoli might be good, but 14 heads of broccoli, not so much, right? You can have too much of a good thing. So let me ask you a really this will be an interesting one. I wonder if there an actual answer to this, which is there something that is good for everyone?
Wow. Is there something that is good for everyone,
So
regardless of?
like I'm thinking like surely nature is good for everyone. Like, is being in nature
Oh yeah.
good for everyone?
Oh,
So, what are the things that are definitely good and you're safe? Like you go, oh God, I don't know whether to advise them to do this or this because that might be driving them in exactly the opposite direction to where I want them to be.
yeah,
But
yeah,
there
yeah,
must be some ones that are stalwarts where you just go, this is
yeah.
reliable. Nature is always good.
Yeah, nature, I mean, grounding, as you say, minerals from the earth, right? And electrons from the earth and frequencies from the earth, right? Grounding, moon bathing, sun bathing, whatever it is. If you have problems with the sun, go moon bathing, go lunar bathing. Getting some sort of a light from distant stars and stuff is good for you. Um, Short chain fatty acids, resistant starches is good for you. Um, if you look at what your cells do, like your DNA makes proteins and makes amino acids. That's what your cells do. That's what your DNA does. And so don't be afraid of amino acids. Don't be afraid of protein. Just take them in amino acid forms. And so there's different, you don't have to have 55 million steaks a day or 25 million eggs a day in order to get your protein. You can take certain powders, certain amino acid powders that help you sort of build your muscle back or build up your body back or build your gut back or build your loss of hair back, whatever it is. You do need protein of some sort, but take it in the amino acid form rather than the collagen form. Um, so I and some minerals, and so when they say your kids should eat dirt, right? And so kids who eat dirt, kids who eat mud, they're actually sort of actually better. They can actually fight germs, and they can have a much more resilient immune system because of that. And we now know that there's things called fulvic humic minerals that you get from the earth, and these are minerals that drive your processes in your body, that actually accelerate processes in your body and helps every reaction in the body run smoother and run better. And so fulvic humic minerals are a thing that you can't really sort of overdo. Um, and so I would say that. So amino acids, bathing, getting outside, getting into nature, getting rid of toxic situations, toxic chemicals in the body. Don't take too many toxic things. Um, but yeah, time restricted eating rather than fasting, eating at certain times of the day. Sleep, of course, is something that everyone should be getting 8 hours, 6 hours, at least 8 hours sleep a night would be nice. Optimizing sleep, optimizing blue light, try and get away from EMF toxicity and blue light. But those are the big things I would say. But in terms of supplement wise, amino acids, fulvic minerals, short chain fatty acids, and getting out in nature. Essential oils, actually. I didn't say essential oils, but
So essential oils,
mm,
are what they're called essential.
yeah.
So that means that they're also essential in our life.
I'm not sure why essential oils got the name essential oils, like essential fatty acids, right? Or essential
Mm.
amino acids, right? I'm not sure why essential oils got that name essential oils. Um, but certainly a lot of people aren't taking oils. I think we can sort of safely say that. But yeah, essential oils are extremely good at fighting off infections and breaking down viruses, breaking down fungus, breaking down mold, breaking down parasites, all these sort of things. Um, and where do we get these oils from? Where do oils come from? They come from the earth, they come from leaves, they come from pine barks, they come from trees, they come from the ground. And so when we talk about doing forest bathing and doing some grounding, you're actually absorbing essential oils. When you do 3 days in the forest to get rid of cancer, you're actually breathing in essential oils all the time. You don't actually have to
Mm.
ingest essential oils, you can just breathe them in. And you do that from doing nature and grounding and doing forest bathing, that kind of thing. And so extremely anti-infectious. And so this is what sort of helps these infections from becoming too much for the body to take. Everybody gets infections, everybody gets viruses, everybody gets infections, but it's whether those things drive your immune system out of control or in one direction. That's what we have to be wary of. And there's just some very simple tweaks that you can do to actually sort of prevent that from happening.
I mean, I find it a fascinating thing because essential oils, when they came out, it was like, I don't know, yoga, for example, now is so accepted for the benefits of it in a Western world.
Yeah.
But people who did yoga in the 70s, it was like, well, they're a bunch of hippies doing weird stuff. Now, all that hippie stuff from the 70s is really mainstream. And I think essential oils was the same. I mean, I first heard of them in the 90s. And I'm like, well, that sounds like a really expensive,
Mm,
way to go about trying to be healthy. And how do they know it even works? I don't, it doesn't make sense. And now I'm
mm.
taking a drop every morning with a big, big lot of water. That's my first thing that I do in the day.
Likewise, yeah.
And and I've found that there was I went to the UK a couple of years ago, and my entire family got the most horrific cold. Like it was like well, flu-y really. They were bedridden for a couple of days, and it just gradually went through the whole lot of them. And I've got four kids, so it went through all of them. And the only difference between me and them, we were all eating the same kind of food, was I was still on the essential oils every morning, and I was the only one that didn't get it. And because our diets were so similar, because we were traveling and we were in the same environment and we were doing the same types of things, it was almost like the litmus test for essential oils. So fascinated by that, and it's happening in my house right now. The number 4 and 5 have just caught this infection that the others been through the others, and so far I'm unaffected again.
Mhm.
It's a fascinating thing because it's tiny, it's one drop,
Yep.
and I ingest it. I also do breathe a little bit in here and there. If I'm in my space like I am now, there are oils burning in the corner right now. Um, so that to me, everyone needs to try it, I guess, to find out, is it enough? But for me, I guess it's just enough to put me over the line. Whereas if you're living a deeply toxic life, it won't stop you getting infections, but it may reduce the number that you get.
Yeah, absolutely. And you can never get rid of infections. We're more bacterial and viral than we are human. And so we have more bacteria and viruses in the body than we do.
Mm,
And so you're not trying to eliminate infections from your body. In fact, infections are healthy within us because it actually sort of drives processes in the body that are actually healthy for us.
mm,
Um, and it makes things in the body that are healthy for us as well. And bacteria make B12, bacteria make iron, bacteria make short chain fatty acids in our body. And so we need these pathogens to help us with our everyday processes. It's just that when these things become overloaded, you might get a fungal overgrowth, you might get a viral overgrowth, you might get a parasite overgrowth, you might get a bacterial overload, like small intestinal bacterial overgrowth. And then you're using certain things that actually sort of calm those things down. And this is where essential oils are very good at that way, is that you only need to take 1 or 2 drops. If you take more than two drops, you know about it because it actually can become, you can take too much essential oils. They're very powerful little things. 1, 2, 3 drops is enough. And I was the same way. I was back in my 20s, I think it was 2020, early 20s, and I didn't know what essential oils was. And the reason why I came around essential oils was basically because I was treating a lady in my practice who had heart aneurysm. And I gave her sort of advice about how she could fix aneurysms in the body. And after about 2 or 3 months of what she was doing with me, she felt great. She didn't need the surgery. She didn't need surgery, etc., etc. She calmed down aneurysm down quite well because of that. But she was an essential oil lady. She made her own essential oils, and her gift was to every time she came in to see me, her gift was to bring an essential oil for me. And
wow.
I kept putting them on the shelf. I sort of put them aside. I don't know what these are for. They smell like crazy. Terrible. But I'm not going to use them. But she used to make her own. So it wasn't like one of those big chains that were making those oils, but she used to make her own thing. But I was like you. I used to get mono quite a bit, and I used to get sort of swollen throat quite a bit. I couldn't even talk sometimes. I couldn't do any public speaking at all because I couldn't actually speak sometimes because my glands would get very swollen. I get very dry throat because of that, and I get very sore throat because of it. And so one of the things that she told me to do was actually put some essential oils onto my tonsils, just to put some essential oils through the skin. And I was like, okay, yeah, sure. And so I did it sort of one a couple of times, and all of a sudden they would actually die down. Essential oils on my skin, not even ingesting them, actually would sort of help me with these tonsils and with this Epstein-Barr virus. And so that was the only thing I got rid of my Epstein-Barr virus. The only thing I got rid of my mono. And I would do liver cleanses all the time. I was like biohacking my life for years, trying to get rid of mono and trying to get rid of
Mm,
tonsils, but I couldn't. And it was only essential oils on the skin for about a week, 10 days that actually got rid of my essential oils. So then that put me down the rabbit hole of why essential oils are so powerful, why they're
yeah.
so good. And they do inhibit viruses, they do break down viruses, and they do inhibit bacteria, and they're very powerful, but they only go after infected cells. So you think, oh, they must break down every single cell in your body. No, they're very
Mm,
smart that way. They only go after infected cells. And so this is why they are very powerful. They only select cells that are infected with certain things. And the good thing about them as well, they're very antibacterial, antifungal, and antiviral. And so a lot of the problems we have these days, we just take one form of treatment, like we just take antibiotics, kill off my bacteria. But when you kill off bacteria, viruses and funguses grow. This is why thrush is so big post antibiotics, is because once you kill off bacteria, viruses and funguses grow. The same thing when you go after fungus. If you kill off funguses, bacteria and viruses grow. And the same thing with viruses. You kill off viruses, bacteria and fungus grow. And so you have to kill off things equally. If you might, if you
Mm,
think about that, you have to, and essential oils has that power of killing off things it sees. And so it won't just kill off one part of your microbiome. It'll actually sort of bring balance back to your microbiome by killing off everything. And so this is why they're quite powerful things. Um, but then I used to start taking it in oil and taking the oil in glass or taking it with water and stuff like that, like just like you're doing these days. And I would have no problems. And so I would actually put my clients on my autoimmune clients on essential oils all the time. And so and I've now figured out which essential oils drive your immune system in different directions as well, which is
mm,
more powerful. And so this is why essential oils, I would say, are extremely good immune boosting things that everyone should be doing each day. And not everybody can do essential oils. This is the biggest thing, though, is that not everybody can do
yeah.
everything, right? And so some people might take essential oils and just get huge problems, huge overreactions from that.
Mm,
And so this is where just breathing essential oils, just putting essential oils in your skin rather than ingesting them is
yeah.
just as powerful. And for young kids, young babies, put them on the soles of their feet, and all of a sudden they're better by the morning. And so they used to have fevers and cough and phlegm in their throats. Put essential oil on their feet, and the next morning they wake up no problems. My son does that. He's a 2-year-old. He does that all the time now. So it's amazing, amazing.
That is amazing.
Mm,
All right. So for people that want to take this further so that they can have this kind of knowledge in their back pocket, the
mm.
pathway in is to do one of the online mentorships with you, I'm assuming.
They can do that. I mean, they also, I mean, we're doing live workshops again. So post-COVID, right? So we used to do live workshops all the time now, but that was blocked by COVID. And so we have an online mentorship and online programs now. But if you want to try before you buy type thing, and so
Mm,
the recording I did 5 years ago with you guys in Perth, right? Actually, the week before we did one in Melbourne, and we recorded that sort of a weekend course. And so you can
mm,
actually get access to that recording. And so you can sort of take a look at that, see how I teach, see what we teach about, see what sort of things that we can sort of do.
mm,
And you can just do that weekend course, and then Monday morning you can actually sort of make changes immediately to your present lifestyle and your present practice.
yeah.
And so yeah, I mean, just doing that weekend course, the foundations course is simple enough. And if you like that, you can take it much further. And so we have a
Mm,
6-month mentorship that we're doing at the moment, and that comes up every twice a year. We do 6-month mentorships for anybody out there, for any
mm,
practitioner out there, whether you're a health coach, whether you're myofascial release, whether you're a chiropractor, doctor, medical practice. Even some of my clients have had success just do the course just from being a client because they want to help their family and want to help their
yeah.
love. And so we open
Yeah.
up the doors to everybody, and so we try and keep things as simple as possible. It does get a little bit like wow, there's a lot of good stuff there, but we try and do it as simply as possible. That's where to go is find those courses that we sort of do online now, or find. I'm going to Europe this year, so we're doing some live workshops in Europe this year, and so you can find me that way as well.
Cool. Well, we'll put your details below the pod anyway, so people can
Yep.
actually reach out to you if they
Awesome.
want to. Um, what if you had like a message like for the world, as it were, like for all the people in the world, what is your message? Like what is it that I guess is your passion for everyone to know or understand or feel?
Yeah. Hmm. That's a nice question there, John. I would say that there's a couple of things, right? And so I would say the biggest, when I see clients, and the initial consult is usually sort of quite dramatic at times, right? And sort of, pulling out information. And so sometimes just being heard for those clients is enough for them to get relief
Mm,
right away. Sometimes the initial consult is so relieving because clients are finally being heard after years and years and years. We've been told there's nothing wrong with them. And obviously seeing a doctor for 5 minutes, they're told that this is incurable, this is untreatable, there's nothing you can do about it. And you're only seen for 5 minutes. You never get to tell your whole story. And so that's important. And so that message of sort of hopefulness. I mean, you get that hope back. And I think
Mm.
drives a lot of healing processes is driven by hope, or a lot of disease processes are driven by hopelessness, right? And so giving people back hope is huge, and that freedom that you get from that is quite liberating. And it's usually the start of your healing process is actually by getting some sort of hope back, some sort of power back into your life. The other thing I would say is dependency. And so um, we don't want to be dependent on supplements. We don't want to be dependent on medications. We don't want to be dependent on anything. And I think freedom in health, like freedom in happiness, is not to keep searching for health, to keep searching for happiness, but just to sort of be and just to sort of exist without worrying about the next thing that you put into your body or the next thing that you do. And so worrying about how many supplements you're taking, or worrying about how many supplements should you take and what should you be taking outside the body. And so a lot of functional medicine practices these days is like taking a bunch of supplements, 25 different supplements for 6 months, 9 months of the year, and you become dependent on these things sometimes. And so I think to find true health, you have to be able to take away those training wheels, take away the stabilizers off your bike, right? Take away supplements in order to get your body get back into its own way of dealing with things, its own innate ability to take care of itself. And sure, you need supplements in the short term, but you shouldn't be on supplements for years. I mean, completely opposite. You actually should take supplements in the short term so that you can actually teach your body how to heal again. And a lot of the times your body has lost its healing capacities, and you're just trying to retrain those things. Once you can retrain those things, once you can teach a man to fish rather than giving a fish, he can change his lifestyle forever after that.
Mm.
Mm.
Powerful message, my friend. Thank you so much for talking to us today.
Thanks, Joel.